I think that we're going to be just falling all over new therapies for HS and figuring out how do we make a choice amongst all of those treatments.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar, how you doing? Hey, I've just been thinking a lot more about all these conditions that we've finally somehow, quote, uncovered. Like hidradenitis suppurativa. What's the deal? What took us so long?
I don't know. This condition, which is no secret on this program, and anywhere I go practically, is one of my favorite to treat, has been for a long time, kept in the dark, so to speak. I think everybody in dermatology knew about this. It's not a new diagnosis in our textbook, but certainly the extent of the impact has been really underestimated. But now, there is hope and there is a future for HS. And I think we wanted to talk about today about HS and its future and how exciting a field it is to be a part of. So I think we have a guest that can help us to share that excitement. And frankly, I don't know anybody right now on this planet who can be so infectious in her excitement about HS as our guest. Shall we introduce her?
Of course. Dr. Joslyn Kirby, she's not just a guest. She's been running programs with us at Learn Skin, and she does a lot of stuff in the HS world. So really excited to have you, Joslyn, join us. And she's a professor of dermatology at Penn State Health, also president of the Hidradenitis Suppurativa Foundation. And in clinic and through her research, she really is focused on HS, including its effects on people and outcome measurement. And I'll just say, I've heard your lectures so many times, and I just think you're very impactful. So thanks for joining us here today, Joslyn.
Thanks, Raja. And I have to say that while I'm the current president of the HS Foundation, I'm very happy to be invited by the incoming president, Hadar, who will take over in March 24. So thanks, buddy.
Yes, thank you for joining us. And we do the usual introduction, but I have to add here that Joslyn is also and has been an amazing mentor to many people, but to me in person. So it's kind of a weird and honor situation to be hosting one of your mentors. So it's fun all around and speaks to the spirit of our field where mentorship really carries forward. And now Joslyn is also a friend. So it's really cool. Hey, let's talk about HS, shall we?
Absolutely. I'm smiling on this side of the microphone. Let's get going.
Yeah, exactly. So before we do, we wanted to talk about the disease state itself because there's some new cool developments about it. But one of the things that we like to do in the program is ask folks who become leaders how they got there. So perhaps you can tell us what drew you to HS to begin with, because I think the first time we met professionally was around acne, and you were that acne person that's going to change the acne world, and somehow HS got in the way. So, and maybe I'm wrong, but tell me, how did that happen to you?
I remember that day, Hadar, when we met standing at one of the SID meetings, and you're right, I had a poster about rosacea. And what was your poster about?
My poster, I don't know. I remember what your poster was about. Your poster was about cost analysis in acne. And I said, geez, can we do this in rosacea?
Oh, that's right. See, you even corrected me. I love it. So I got into HS because of that same sort of theme in how I ask questions. It's, I want to know why we do what we do and what the pros and cons are and how we can do it better. And that sometimes means money, but sometimes it means how do we just do a better job taking care of people? So you asked, why did I get into HS? And it's because I felt like I just wasn't good at it. And so if there's a message for anyone in this, it's, well, you don't have to become a specialist in HS. You can feel like it's okay that HS is hard, but that doesn't have to be that you turn away from it. It just means this is a really challenging condition to treat, and we all find it challenging. And I just leaned way into it and fell into the vat of pursuing HS as my niche.
That's a wonderful kind of attitude, right? When things are not so easy for you professionally to just lean into it. I know I do this in many different ways. I think I have certain diseases that I feel like I'm always blind to. So I'm acutely aware of my blindness and trying to kind of lean into that. That's a wonderful thing. And I think a great lesson for everybody listening. So can you summarize for the folks here who may have heard about this diagnosis, and we have some listeners who are not necessarily healthcare professionals, what is hidradenitis suppurativa? You have given hours of lectures on this, but briefly, what is the condition that we're talking about?
Hidradenitis suppurativa, or HS, I often say is the most common condition that you've never heard of, whether you are the person affected by it or you are the healthcare provider who's maybe had it walk into your room, but you didn't see it. So it can manifest as what looks like inflamed hair follicles. We sometimes write it off as shaving bumps, or someone's maybe not using the right soap, or we think it's because we didn't wash towels the right way and we need to either change how often we do it. So there's a lot of, I think, causation, and I say that in place of blame, but that is very often what our patients unfortunately struggle with. Is they look for and blame themselves for about 1 to 2 years before they come to a healthcare provider, because what we're doing right now, which is to get the word out, that if you just keep getting pink bumps, inflammation around your hair follicles and folds of the body, like under the arms, on the chest, in the fold of the groin, on the buttocks, or in places where you get a lot of friction, maybe around the waist, again, on the buttocks, that's probably not something you're doing. It could be your own immune system. And so hidradenitis is really an overactivation of the immune system that gets misinterpreted as many other things: folliculitis, acne, boils, MRSA.
Right. I think it's really a nice way to sum it up. And you touched on a point that a lot of the patients come to us. And when they eventually come to us, they tell a story that is all too common of the path to diagnosis. And I share your feeling exactly. I hear a lot of my patients tell me, I saw this doctor and that doctor, and they weren't sure what this is, or something that really, maybe I'm using strong language, but almost offends me as a healthcare provider when they are given a treatment but not told what it is. And they say, go to the dermatologist, they'll discuss it with you. I've heard that, not a common thing. And I always chuck it off to saying, I think the doctor may have explained it, but maybe we just don't, sometimes there's just too much information and the patients don't remember. But definitely there is that path that patients go through that is not optimal. And we know the literature quotes this number that patients go up to 10 years, or an average 10 years, before they actually get a diagnosis and begin treatment, which is so frustrating and enraging to think that, if someone had a cancer and we'd wait 10 years to tell them about it, it just, the mind boggles. And so that's part of what we're trying to do here. And so for those who are listening to us, how is HS commonly treated? What treatments are available if people go to their healthcare provider?
So I agree with you 100%, which is we do need to get to treatment. And I want to touch a little bit on what you mentioned, Hadar, about that challenge of getting to diagnosis and even the hesitancy that might be out there to say, I think you might have HS. So I want to touch on that hesitancy because I think it comes from a couple different places. One is hesitancy because if you give somebody the diagnosis of HS, that it's a worry that they're going to look at it on the internet and see the pictures of the most advanced and severe, and that they're going to think that that's going to be them. So first off, we know that not everyone with HS progresses. We know that some people do, but not everyone does. So if you see someone with more mild or moderate, that diagnostic term to say what's happening on your skin is something called HS or hidradenitis has brought tears to somebody's eyes. And it is that meaningful for them to know that this is not something as simple, and I do that in finger quotes, as simple as hair bumps or friction or not using the right soap. It is meaningful to know that the past 1 year, 3 years, 12 years, like you said, has been because of a real, again, in quotes, condition. So it is, I think, so valuable. Even if you as a healthcare provider aren't sure what to do next, know that you can give somebody a lot of peace just by giving them a name for it. And if you're not sure, it's okay to hedge a little bit and say, I think this might be a condition called HS, but I'm not sure. So I want to refer you to a dermatologist. That way you're just bridging and you've given them something to look at. And you can even say, if you look on the internet, you're going to see the best of the best or the worst of the worst. So I don't want you to think that's going to be you. But I think the second reason for hesitancy is where we have been in our history in the treatment of HS, which is it has been a struggle. And to give somebody a diagnosis of HS is sometimes the most we feel like we could do because our treatments just have not been highly effective. But that is changing. And so to be able to give somebody the diagnosis now is just the beginning of really being able to give them treatments that are going to change their lives. And so there is a lot of meaning and I think less resistance in my mind. And I hope for all of you listening to give that diagnosis because there is now, for lack of a better word, a lot of firepower behind our treatments that we can give people. They can really make a difference. So how do I approach it? My approach to treatment of any condition, whether that's HS or anything else, is always to try and strike a balance between what is the impact of that condition, the side effects of that condition, and maybe the risk or side effects of the treatment that I'm maybe considering giving them. Because I don't want to give somebody with really severe HS a dinky treatment that doesn't come with a lot of risk, but also really doesn't come with a lot of efficacy. But on the other hand, I don't want to give somebody with mild HS that rarely impacts them or infrequently impacts them a treatment that comes with a whole lot of risk. And so it's striking that balance between what is your experience with your HS? How often does it interfere with your life? To what severity does it impact your life? And what am I asking you to do in terms of treatment?
Joslyn, can you talk a little bit about that actually a little bit more directly? Because I think you're touching upon something that's so important with HS, which is that it's a little bit of a hidden disease. If you see someone, you don't necessarily know they have HS, like maybe psoriasis or say, acne or rosacea. I mean, it's in those intertriginous areas and it obviously affects all kinds of aspects of their life. What do you use to determine severity? And is it based on the physical exam, I'm assuming, but what are some of the other questions that you're asking to really understand how is this impacting their life?
That's a great point. So I need to let you know I work in an academic center. I have a HS clinic. People come to me because they are coming to an HS clinic. So our patients, when they're brought back, our nurses pretty much invite them with a very sweet but heavy, firm voice. We would really love it if you could put on a gown so that way we can take a look. So it's a pretty rare day that I don't examine somebody and look in some of those places where people would be otherwise, I think, less likely to show if they came in for acne or they came in for a spot on their leg. You might really have to ask somebody if they came in with severe acne. Sometimes people with severe acne can get some of these bumps under their arms or in their groins or in other places. Have you ever had pimples, in a place that wasn't your chest, shoulders, back, or face? So, number one, I do look at people's skin. I tend to also keep in mind that people pretty much always come in on a good day. Wouldn't you know it? You come into the clinic and you can't show your provider your skin when it's most flared up. It's, of course, on its best behavior. And so this brings up an important point, which is when I assess people, it involves their skin, but it definitely involves asking questions about how many bad weeks do you have in a month? And I usually don't have to explain what a bad week means. People know that that means weeks where they have had pain from their HS, weeks where they couldn't walk normally or raise their arms or pick up their kids or hug a loved one or walk to the copier at work. So people know that, and I listen. Sometimes it's actually hard to answer that question, and I have to reverse it. How many good weeks do you have in a month? And it's by asking that question that I think it helps both the person with HS and me figure out just how severe their condition is, and therefore going back to that equation of balancing impact of HS versus impact of treatment. Do I need to escalate? Do we, in our conversation need to escalate? But Raja, let me throw in that I think a hidden point to your question is when people come into your clinic, whether you practice in an academic center or not, if you're practicing derm or something else, and somebody comes in and they have severe acne, if they have a pilonidal cyst or pilonidal disease, if they have dissecting scalp cellulitis, which are sort of boils on the scalp that last for years, those are three things that can trigger us to look for HS because they very often run together. So when you see acne, look for HS. And I think you'll find that it's there more than you would expect.
I appreciate that, Joslyn. And then what about the other deeper, like psychological aspects? How do you approach, sexual health, social health, emotional health with them? And do you take that into account with the severity when you're thinking about treatments?
Absolutely, Raja. So all of those things are really important to thinking about how HS is impacting somebody's life. And, many of us are trying to be efficient with our time and our patients' time. And sometimes it's, a little harder to ask those questions. So what I have done is I've used some instruments, so scales, that I can give people either through my electronic medical record or just on a piece of paper. And so it allows people to fill it out either right before they come into clinic on their phones, on their computers at home, or in the waiting room. And then I can look at it before I go into the room. And it's a conversation starter. I can say, it looks like based on some of these questions, you might have some depression. It's definitely uncovered suicidal ideation in people where I think I would not have guessed that going in. And that's a really important conversation and a place where we can give people resources about if they have those thoughts again, who they can call and resources they can turn to. And also mental health, which certainly is stretched pretty thin in my part of Pennsylvania, but there's always support groups, the suicide hotline across the United States, 988. There's any place, PCPs, again, they can call me if they're having trouble, but there are always resources.
I think that's such great advice. And, I think one thing we didn't include in the introduction because there's so much to say about what Joslyn's work, but one of her areas of expertise is measuring the severity of HS. And she's made really seminal contributions to our field with that. So one day I challenged Joslyn. I said, hey, can we summarize this to give clinicians? And we did publish a non-validated kind of paper on getting a little bit of potpourri from each important tool that relates to this. And that's out there in the literature. Maybe we'll put a link to that article. So busy clinicians, if you don't have access to an EMR that can send these tools ahead of time, which I also try to do in my clinic, but we really were adamant to keep it down to about 10 questions that can give you a good picture as to what's going on there. And that touches on anxiety and depression and all these other comorbidities that are, wow, like I would say probably just as important as the severity of the skin. And as Joslyn, Rogers, you guys are talking, I'm writing down notes, and I can probably comment on what you said for about 10 hours. But I want to say two things here. One is the importance of full skin exam. This is something I teach the residents, and I think it's so important, even for the diagnosis. If you go by technical terms, HS has to be a recurrent disease, and sometimes patients don't remember because they're like, oh, I just have this thing in my armpit. I don't know why we're making such a big fuss about it. But then when you look, you see all these small scars and hyperpigmentation hyperpigmentation and all these areas that you can start asking, hey, did you have this here? Did you have that there? And all of a sudden together you're discovering, oh, this is a chronic problem. This is been bothering me. And then, it may sound overwhelming. And the other concept I want to highlight is called that, what is a visit 1 topic? What is a visit 2 topic? What is a visit 3 topic, right? And you may be that clinician that for you talking about the psychosocial impact of the disease is not necessarily something you're comfortable with, or you want to do it as a visit 1 topic. And for some patients, it may not be appropriate. They're coming here, clearly the skin is in big problem. What we have to focus today is make sure that they're not in pain, that they're not draining everywhere. And then when they come back and they feel a little more comfortable, we can have those other conversations. So if you're a clinician listening out there, nothing has to happen in an instant. People, as we heard, lived with this for years sometimes. And one of the things I tell patients is, hey, you had it for 3 years. Give me a few months to get you where I think we can get. And I think that kind of comment resonates with a lot of my patients. But enough about this. I wanted to ask you, Joslyn, what excites you about the future of HS? Because as you mentioned, now we have treatment with a lot of firepower and we get a lot of resources now that become more and more available. And so what can you tell the clinicians of tomorrow, the patients who may be listening to this podcast? What is exciting? What is coming down the pipeline that excites you? Anything in our field that makes you optimistic about HS?
So I'm smiling behind my microphone because
Good.
I feel like we are living through right now a revolution in HS. And it took 15 to 20 years to really change psoriasis and the way that things happened. But it's going to happen so much faster in HS. And that's why I'm smiling, because we have seen the promise of what, again, finally realizing that the immune system is the cause of this, not soaps, not shaving, that it's internal and that people's immune systems are hyperactive. And we now have a better idea of that, but we're going to have an even better idea of it in the coming year or 2 or 3. And so Hadar and we do trials. We have seen just the pipeline of therapies that are being aimed at HS. And it gives me so much hope because I see people who enroll in these trials and do all of us such a service to be willing to try these investigational therapies. And some of them do so incredibly. So while it feels like we struggle, and it's the community it's the people with HS, it's the providers who feel like they just can't get people as well as they would like. That's your big heart. Don't worry, we're going to get there. And there are so many treatments that are coming. So the ones that are here right now, we just got our second FDA-approved therapy. So that's secukinumab. It's in a different class than our first FDA-approved therapy, which was adalimumab. So we have an IL-17A inhibitor when before we had a TNF-alpha inhibitor. We're going to have another 17A and F inhibitor probably in about 10 to 12 months. That will be bimekizumab. So I expect that to be our third FDA-approved therapy. And hot on its heels are going to be a fourth and fifth and a sixth. So I think that we're going to be just falling all over new therapies for HS and figuring out how do we make a choice amongst all of those treatments. So we will have gone from struggling to find one and the right one to having a gluttony of options.
Absolutely. And I share so much your excitement. And one comment on clinical trials, which, by the way, Raja is also doing clinical trials in many fields. One of them is HS. And the other day, I walked into a room, so I met a new patient. And that patient told me, they were getting some treatment years ago, and then they kind of fell off the wagon. Life hit them, and they couldn't take care of their skin. And so now they're coming back, and they said they were in this trial for an injection. And I said, was one thing led to another. We recognized that this patient was part of the trial for adalimumab, which led to the drug being approved and helping so many patients. Forget what it did to the field, but just helping real people. And, I was able to reflect back to that patient, you were part of changing the world when it comes to HS. And that feeling is so empowering. that, it was just kind of a moment of elation in the room that everybody was so happy and giddy. It's not a common thing in HS, so it was fun. So thank you for highlighting the role that patients play as part of this revolution. Joslyn, before we let you go, I think it would be great if we can talk about resources. So for patients and for clinicians. And obviously, the big bear in the room here is the HS Foundation. Can you tell us why should people go to the HS Foundation website and what can they find there that can help their day-to-day?
And it's a nice big cuddly teddy bear, right? Because it helps. Not a grizzly.
Thank you,
but it has a
Razia.
lot of power. Yeah.
There was my contribution to this podcast, by the way.
Depending on what you come with, it's big and cuddly or big and fearsome. So that is, if you are fighting a prior authorization, that is when our bear kind of has some claws. So please visit the hs-foundation.org website if you are a clinician looking for some help to advocate for your patient for a medication that is either on label or off label. So at the top of our website, under resources, there are resources for patients. And again, as a clinician, you can refer your patient there. As a patient, please come, look, learn about your condition, share it with others. But under clinicians, there's a few different things. One is that prior authorization template, which you can download. And I should mention, you do not need to create an account. This is not a place where you have to sign up in order to get free help. And it is free. You can get those templates. Please share them with anyone in your office who helps you with prior authorizations. They include references. Just fill in the blanks and you can send them off to the company that is being a little bit stubborn. There's also free CME on HS that you can look at yourself or share with your non-dermatologist friends. So our goal is to get the word out to urgent cares, emergency departments, surgeons, OBGYNs, primary care. These are all places where people with HS are very frequently touching care, but maybe not getting the diagnosis. And if you're a researcher, we've got some grants. So we are always trying to develop the next new therapy and discover more about HS so we can help more patients.
Great. No, that's awesome. And speaking of CME, Joslyn has done a spectacular work on learnskin.com and one of the many other series that you can find and information you can find now about HS. But Joslyn, I was just kind of browsing through the amount of expertise that you were able to gather for that lecture series on HS is spectacular. And so that's, I believe, a free CME that's available to folks on learnskin.com. You can go and grab that HS series. There are experts galore, room to room. I don't want to name names because I'm going to leave someone out. But
well, I feel like you and Raja are both on it. So everybody go look it up.
Yeah. You can learn about pathogenesis of HS, upcoming treatments, how to diagnose it, the whole thing, soup to nuts. You will leave that an HS expert as well. So certainly. And I just want to add on the HS Foundation website also for patients, if you happen to be a patient listening to this, you can find the HS Foundation specialty clinics section where you can look up your state and hopefully find a clinician there that's not, any dermatologist can help you with HS, but these are people who said, hey, we really are passionate about this and we want to treat you. So I think it's always fun to go to a place that they really want to see you. And you can find other opportunities to become part of the community and connect with related organization. And there's also a pamphlet there that can help you to learn at least some basic terms about this. And also clinicians can use that if you wanted to give that in your practice. So definitely a lot of resources for patients, clinicians, researchers, and all of that is all around you. So take advantage of these resources out there. Become the best HS patient or HS clinician you can be. All right. So with that, I want to thank you so much, Joslyn, not just for your generosity of time joining us today, but just the amount of time and energy that you put into everything that you do, and including with that, the HS Foundation and the rest of the work in HS, because it's moving the needle. So thank you for joining us. Thank you for your expertise. And I'm looking forward to further conversations.
Thank you.
Folks, I hope you enjoyed this episode. And if you enjoy learning about integrative dermatology, we want to fill you in on a little secret. It does not have to stop here.
That's correct. You should become a premium member.
A premium member? Hey, Raja, tell us, what does that mean?
Well, we have a private community at Learn Skin for practitioners who want to learn more and connect even more closely with like-minded colleagues.
That's correct. This is something that we have developed over the years based on what we wished we learned in training. Not only do you get a discount to the annual Integrative Dermatology Symposium, but you also get exclusive access to content that is not available to the public and a private online community to network and engage with.
So don't wait. Together, we can advance patient care. Join us as a premium member today, and let's get integrated.